One of the things I like to do is when I first meet a patient, I allocate up to an hour to spend with patients, because it's really important that I understand their journey and I understand the ups and downs that's brought them, that they've had around having a lived experience with obesity. And no one's the same. And for some people, there have been emotions related to their upbringing or to things that have happened in life that have been difficult. Some people have other illnesses related to psychiatric illness, such as depression, anxiety, or schizophrenia or bipolar. Or they've had an eating disorder. And so obviously this is not a 5-minute medicine type approach. But what that enables me to do is really be able to individualise what that patient needs from an emotional point of view, because not everyone's the same. Some people really struggle with emotional eating patterns and some people don't as much. And it's working out what that patient needs in order to walk this journey. The other thing is, losing an awful lot of weight can change the way you relate to other people and people relate to you, and everybody's individual on how they manage that. Some people tell people they've had surgery, some people don't. And so it's really important that as their doctor, where it's confidential and they can put the guard down, that we're able to talk through the emotions around that, if that's something that the patients need. And people have all sorts of emotional responses some are common, some are less, about shopping, about how they feel, about comments that people make about their weight loss, and so we can provide support. There are times where I do recommend that people engage with a psychologist, because they need to have more specific help with some of those emotional eating patterns or emotions around weight loss and around managing their illness. And so we'll engage them as part of the team if that's the appropriate thing. But I think the important thing is for them to feel comfortable, to know they're going to get a compassionate doctor, not a doctor that's going to tell them off if they've fallen over in some of their behaviours, and to actually be real and be able to work out some real goals that were going to help them make their journey effective. Because no one comes and has bariatric surgery and wants to put the weight back on or have a poor outcome. So my job is to really help make sure they have a really good outcome and they're really happy with the results and the improvement in their life and health and well-being that happens when they manage their obesity effectively over the long term.